What can I do about pain under my kneecap? This is a question I get asked a lot. And when I talk about pain under the kneecap, I'm talking about below the kneecap. If you're looking for information about behind the kneecap, I have another post about that. Pain below the kneecap can be because your kneecap is literally tilting down too much. The way the kneecap is anatomically made, imagine it's almost a heart shape. It's bigger at the top and it comes to a point at the bottom. This is kind of how the kneecap or the patella looks. If there's a tightness at the bottom or at the tip of the patella, it can tilt down too much. And when the quad is tight, it will compress the kneecap. And if the kneecap is tilting down, there'll be more pressure at that spot. So what can you do about a tilting patella? One of my favorite treatments for a tilting patella is to massage and stretch out the area at the bottom of the patella. When I work with clients one-on-one in person, I'll place my hand at the top of the kneecap, just at the edge, and I'll put some pressure to counter the tilt and tilt it in the opposite way. Then I'll massage the bottom part of the kneecap where the pain and the pressure is. After the massage treatment to the patella, there must be a regular strength and flexibility program. If I just release the pressure of the kneecap, that will resolve the symptoms in the short term, but it doesn't get rid of the root cause of the problem as to why the pressure happened in the first place. And the pressure likely happened in the first place because of an imbalance in the strength and flexibility of the quad muscle, the hip muscles, and other muscles of the legs. They all work together. It's not just one group that needs to be balanced out. So I always make sure my clients have a good, well-rounded strength, endurance, flexibility, mobility, and balance program. Okay, let's recap. You may have pain just below the kneecap, inferior to the kneecap, because of an imbalance in the muscle strength and flexibility, partly in the quadriceps muscle, as well as other muscles of the legs. When the quad contracts, it tightens down the kneecap normally, and if the imbalance is there, it will add much more pressure. My favorite treatment is to counter the pressure with my hand and massage below the kneecap. Follow up with strength and flexibility to have a well-rounded routine. For more tips and tricks, follow along.